like to welcome you to our fifth and last Board of Governor review series for this season. In behalf of San Diego Organization of Healthcare Leaders and California Association of Healthcare Leaders, we would like to welcome you. And our topics or board for today are the healthcare technology and information management and the quality and performance management. Next slide, please. So before we begin, we would like to introduce the member of the advancement committee for both chapters. I'm Michael DeCoco, and thank you for being here. Nora? Next is Nora.
Hi, good morning. Sorry, caught me off camera.
Good morning, everyone.
And Sashan is not here today, and Tui.
Hi, good morning, everyone. I'm Tweedo. Nice to be here.
And for our partner from San Diego.
Yeah, happy Saturday and wishing you all good luck on the exam.
Good morning, everyone.
And next slide, please. So we have some FAQs and updates for you before we'll proceed to the main topic today. So we'll ask Nora to give us some updates.
Hi. So we wanted to follow up with the patient bill of rights that we discussed last week when we were looking at that really funky question. So we wanted to include it here, the link to it. Another thing we wanted to follow up on is the question about what's the problem with like a large size of the board, and I just wanted to put the reference in there for you from the Well-Managed Healthcare Organization, Chapter 4. And be on the lookout for the Survey Monkey. It will be coming out shortly. And again, we do take that very, very seriously. So please pay it forward so that our sessions keep getting better and better. Thank you.
Thank you, Nora. Next slide. Okay, so Tui, would you like to introduce our speaker for the information and technology? Oh, Tui, I'm sorry, Jessica.
Hi.
Yeah, good morning, everyone. We're excited to welcome Angela Rivera. I apologize. More coffee this morning. Glad to welcome Angela to this morning. She is a market leader and cybersecurity advisor at the Chartist Group. She is based here in San Diego. She's a fellow of the Health Information Management System Society, HIMSS, which they recently had their annual conference. And she's former president of the Southern California chapter of ACHE. She was named a woman in healthcare IT to know by Becker's Hospital Review in 2018 and 19. And she's also a certified information security manager, very important in these high risk days. And she was sharing with us a little bit about what that is, the environment is like for hospitals and health systems today. So glad to turn it over to Angela for today's question and review on IT. Thank you, Angela.
Great, thank you for having me. So next slide, please. So there's really, I think 8 core areas that we want to make sure that you're attuned to as you embark on your exam. The first is really understanding the role and function of information technology or IT related to business operations and healthcare. You know, many of you have a variety of different roles within the organization, but may be aligned with the IT department to achieve some of your goals that you have for your department. Or you may be asked to participate in some level of steering committee or design teams as the organization embarks on new information technology. So it's really important to understand the role and function of IT within healthcare. The second is really understanding the latest technology trends and clinical applications within a healthcare organization. And that can be clinical systems, administrative systems, decision support systems. Those are 3 key ones that you'll probably be asked about. And the technology trends right now, you know, interoperability and being secure, cybersecurity, as Jessica was referencing, is a significant risk for healthcare right now. Ransomware, you may be hearing about it on the news or within your own health system. Ransomware increased over 700% this year in healthcare environments. So it's a high target industry. And so it's really important to understand some of those areas that are going to impact your organization. Having a really nice baseline knowledge of some of the policies and regulations out there, such as HIPAA, you know, which relates to privacy and security of protected health information, the HITECH Act, meaningful use. There's lots of, you know, different sorts of regulations that you may hear about. I would say, you know, remember the ARA, and that was 2009. HITECH also was 2009. We also have the Affordable Care Act. We have meaningful use, which is part of, you know, part of ARA and HITECH. And then they renamed it to Promoting Interoperability. So just keep those kind of top of mind. And then understanding health informatics and how that really helps making smart operational decisions for the organization. That'll be important as well. Next slide. And then the last four are really, you know, understanding the potential impacts and consequences of some of the IT decision making on staff and processes. And that can be across the enterprise, finance, operations, you know, how IT might impact the quality of care. So you might find some questions that really want to understand, you know, what's IT doing for the organization in these areas? And just always keep in mind that IT is there to be an enabler for the organization to achieve its business goals, or for the departments to achieve its business goals. So an enabler and a support team is what IT really is to the organization. And then understanding the information systems, business continuity and disaster recovery planning. This is really important, especially as you move into leadership roles. You will be asked, if you haven't been already, asked to participate in helping the organization and IT teams understand if something goes down, if there's a disaster, if there's a flood, a hurricane, a wildfire, if the organization gets hacked, what are we going to do to keep business moving? So that's the business continuity part. And what are we going to do to recover? So that's the disaster recovery part. And it's really critical that the business unit leaders participate, because IT needs to know from you, you know, what needs to be done and what they're going to be helping you do in an event of a nature like that. And then really understanding the selection process, you know, how the acquisition of IT systems happen. That can be from, you know, the very beginning when you're trying to determine your needs, you know, analyzing what needs you have, to doing the design, participating in the implementation and upgrades. Your team will obviously be, well, maybe not obviously, but your teams should be participating in all of the testing, and you'll have like user testing requirements. And so they want to make sure that everybody that knows what the system should do is participating in those life cycles. And then knowledge of healthcare analytics. Many organizations either have analytics teams or programs, or they're building them now, but there's so much data out there now, and, you know, really trying to do your best to leverage that data and maximize the use of all the information you have is really the goal of the healthcare analytics team. So before we get into the quiz questions, I just want to give a couple of tips on test taking. I have had to take numerous tests from an IT and security perspective. And a couple of common things happen across all of these certification exams. So I'll leave you with 3 things. If you are unclear, if you really don't know the answer and you're kind of in that position where you need to guess, I would say there's 3 things to remember. One is that IT plans or strategies should really align with the organizational strategic objectives. So if in doubt in any of these questions, if there's something that says that and you don't think it's something else or you're unsure, I would go with that answer, because that's really one of the most important things about IT. The second is that, and I mentioned it earlier, IT really supports business objectives. So having enterprise engagement in important decisions that IT makes is really important. They're not going to make decisions in a silo. They really need to understand the needs of the various business units and who's going to be interacting with the technology that they're trying to implement. And then last is, no project is going to be successful without executive support and buy-in. So just always remember that as you're looking at these questions and trying to come up with the right answer, that is critical to the success of any project. Okay, any questions so far based on just what you think you're going to have to know? And I know that you all received various supplemental learning materials. I think there was another slide deck that was provided that had just a ton of information. And I went through that real quick before this session. And I would say slide 6, 9 through 11, 13, 14, and 20 are going to be really important for you to master. Okay, and I'll say that one more time. 6, 9 through 11, 13, 14, and 20. Okay, so if no questions, let's dive into the sample quiz. So I'm going to read these, and then what we'd like to do is have everybody put their answer in the chat, and we'll see how well the team is doing. So the first question is, a CMS program that requires provider to consult a qualified clinical decision support mechanism, or CDSM, for the appropriateness of diagnostic imaging services is called, and you have 4 choices there. And are we seeing things in the chat? Okay, here we go.
I'm seeing, we're seeing A.
Okay.
Yeah, so I got 2 A's here in the chat room right now. So
Okay, that might be a hard one for folks then, I'm guessing. Any more guesses? Okay, so A is actually the High-Tech Act, and that's part of the American Recovery and Reinvestment Act, which is making health EHRs interoperable. So that would not be the correct answer. And so so I would just say for this one, the correct answer, if you want, I can't tell, sorry, my chat is covering. If you want to show the correct answer, it's B. So for this one, I would just make sure that you understand those regulations that I had mentioned before. So that's ARA, High-Tech, Affordable Care Act, and Promoting Interoperability. Because if you were to know those, you would be able to narrow that wasn't any of that's not the description. So that's really a process of elimination. And to be honest, I didn't know this and I had to look it up when I first saw the question. but I knew the other ones, so I just didn't know what this particular act did.
And this one is PAMA, they call it the PAMA Act of 2014, mostly related to outpatient services for ancillary services like laboratory diagnostic services. For those of you who are in the ambulatory care space.
Yeah, so that probably was the toughest one for me too. So I had to do that process of elimination. But please, when you do study those that I mentioned, and then you probably would get it because you'd realize that that was the only one that made sense. Okay. The second question, the COVID-19 pandemic played a significant role in the expansion of telehealth with 1135 waiver by doing what?
We're getting these.
Okay, so we had D's and C's I saw. So if you want to show the correct answer. So it is D. So it is that Medicare is paying for office, hospital, and other visits through telehealth across the county, including, except it's probably country, but I'm not sure if that's country or county, but, including patient's place of residence. So C was indicated it's encouraging a non-face-to-face communication, which we know telehealth is more traditionally, you know, they're trying to get online face-to-face. Yes, you could do it by phone, but most organizations were trying to capture that face-to-face communication. For those that couldn't do face-to-face via telehealth, they were covering, but I would just read those two questions carefully and note that the word telehealth was in the answer to D as well. Okay, 3. What is the main focus of the government when intervening to health information issues? Okay, if you'd like to show the answer. I think everybody got that one right. Yay, that makes me feel better since I'm in security. So patient information, privacy, and security is definitely what the government will intervene on related to health information issues. You may know or may have heard of something that we call the wall of shame. It's too bad, we probably need to change that title, but it's any organization that has 500 or more patient records exposed or breached has to report it to OCR. So that's the government, and they want to make sure that organizations are doing everything they can to protect that patient privacy and security. Okay, next question. You know what, this was really hard to read, so I'm going to let you all read it and take a guess. We'll give you a little extra time. Okay, so let's go ahead and show the answer and we'll talk through it. B, okay, so I'm pleased that everybody is so worried about the reliability and validity of data, so that's great. But if at the end of the sentence you said, therefore the information system strategic plan, right? So the strategic plan really isn't doing anything to ensure reliability and validity of data. An IT strategic plan is so much more robust than that, right? But go back to what I said of my top 3 tips to think about. So the IT plan and or their goal is a team is to support the enterprise organization with their needs, right? So their strategic plan can't just be focused in one siloed area, and they need to include multiple operating units across the organization to make sure their plan is complete. Okay, and a strategic plan is a lot more high level too. So there could be a policy within IT that talks about ensuring the reliability and validity of data, but it wouldn't be in the overall strategic plan. So it's just really important to read, and this is a really long question and it makes it much more difficult to really pinpoint what part of this question is most important. Okay, next question. Why is it important for the IT strategy to align with the organization's goals and objectives? Okay, let's show the answer. Yay, everybody got that one right. Yes, so again, the IT strategy should look at all different aspects, right? So management, providers, consumers, and these were, I thought these were pretty, this was a softball question just based even on the process of elimination. You know, to allow the CEO to control spending or to give CEO a seat on the executive committee. I think you all know that's not what an IT strategy should be for. So, okay, let's move on. What competencies do not matter in selecting a CIO? And one point before you answer that, read your questions very slowly, and I always recommend reading them twice. Because if you read too fast, you could read this as what competencies matter, right? So just make sure what competencies do not matter in selecting a CIO. All right, let's show the answer. Great. All right, everybody knew that one. That may have been a little bit of a softball, but or you're just getting really good. So, all right, next question. One of the major elements of a strategic IT plan is show the answer, please. Yeah, you all got it. Good job. Yeah, so an IT plan is much bigger than specifications, proposals. So the plan is more overarching. So you're right about that. And it aligns with strategic objectives, which is one of the top 3 things. So. Next question. The element most critical to the successful design and implementation of an executive decision support system in a healthcare organization is? Okay, let's show the answer. Great job. All right. And we mentioned that as one of the top 3, so that's great. It's coming up again. Next question. The goal of HIPAA in terms of security and privacy was to do what? All right, let's show that answer. All right, so this was, this is a little bit of a throw off because, oops, I just lost the screen here, hold on. Because yes, the goal, one of the goals of HIPAA, right, is to, you have your HIPAA security rule and stuff like that. But initially, it really was to improve the effectiveness of health exchange, data exchange. So again, I would just say, please study your different regulations and acts. And so HIPAA, ARA, High-Tech, Affordable Care Act. So just remember to study those. And you don't have to go into detail. You can just say, what are the primary goals of HIPAA? And you'll find that online. So. And then somebody also mentioned saying process of elimination. Yes, so if you know some of the others, like the ARA, and then you can eliminate the other incorrect answers. Okay. 10, proprietary medical information is protected within an organization on what type of server? Okay, we can show the answer. All right, everybody got that one right, it looks like, so that's great. Yes, when just the key word is within an organization. So the intranet is within the organization, internet is outside. Extranet is between two parties, and there's no such thing as a secure net. So I wish there were. That's, although I'd be out of business. Okay, knowledge management is defined as okay, let's go ahead and show the answer. All right, A. So this one is also a little tough just because D mentions organizing and controlling resources. And if you think of data or intellectual assets as resources, part of that answer is correct. But really the reason why A is correct is because knowledge management system is a SharePoint, for example, within your organization. And if you know how your organization tracks intellectual assets, right? So where do you go to get stuff in a centralized location? That's called a knowledge management system. And so that's where you track and renew and update all of your intellectual assets and keep them coordinated and organized and saved in one centralized location to maximize organizational effectiveness. So D had a little bit of somewhat of the right answer, but in process of elimination, it didn't have it all. So. Okay, next question. I think we're almost down, a few more. Which of the following is a reason that system support of outcomes data collection and analysis can be very complex? Okay, let's show the answer. Yeah, I think everybody got that one right. Yes, you probably know, working in your organization, depending on the size of the organization, large organizations can have hundreds of different systems that they're pulling data from. So to make a decision, usually you are pulling from multiple information systems and sometimes manual systems. And David mentioned it. Yeah, that's what creates data silos. And then you've got lakes that have some information, but really you know, it's just so important that you understand that there's complexities when you're trying to make those important decisions and analyze data. Okay, next question. One of the major elements of an information system strategic plan includes the what? Okay, show the answer, please. Everybody got that one right. So great job there. Yeah, everything else was way too specific to be in a strategic plan. So great job. The next question, selection of an information system in a healthcare organization should begin with what? Okay, let's show the answer. Yeah, C. So just remember, one of the, if you don't know for sure, Everything IS does, excuse me, aligns with the existing strategic objectives of the organization. So in a selection, and unfortunately, if you don't have a mature organization, a lot of times there'll be departments, this happens especially for the small, ancillary departments. So you might have cardiology leads or radiologists that are looking at technology and they're getting all excited about it, and they're just evaluating, the systems, and then they say, oh, I want to buy this new cool tool, right? That's really not the best practice. So while that was an option here and your organization might be doing it, it is not best practice to start with available software that you think meets the need of, a few cardiologists. So it's really important that your information systems plan first supports the strategic objectives. Then you can start the analysis and other things to determine what you want to put into, let's say, an RFP to select the right tool for you. Okay, next, please. A comprehensive information security policy should include all of the following elements except. Okay, let's go ahead and show the answer. Can we show the answer on this one? There we go. So this was a tough one. So just remember, a security policy is an overarching goal for the organization, and it sets what the organization is trying to achieve, right? So in a policy, you're going to have information on what management needs to be doing related to a policy, right? Management needs to be, the policy is that there's a good governance program. So that's management policies, right, within security. We need to make sure that the organization has a good data backup and recovery for the organization. It's a policy, okay? That we have solid physical security. The organization has that. What a policy doesn't do is indicate what controls are going to be in place, because those could change. So, for example, a technical control is like a tool, right? So policy will say, we want to make sure that the organization is being proactive in managing the physical security of the organization, but it's not going to say, and we're going to do it by having somebody at the front desk, by having key badge entry into the facility, by ensuring that we've got cameras, right? So all of those are technical controls. That's too detailed for a policy. So hopefully that makes sense. So just note that a policy does not include controls. Controls are way too detailed and more tactically how you're going to do it. Okay. Next question, and I think this might be the last one. In the IT system development lifecycle, which is the most important step? And I may have given this away on a prior question. Okay, let's show the answer to this one. I actually did give this away on a prior question, and we were talking about system selection. So system analysis, it's really the requirements. What does the organization need to achieve the objectives? Whether it's a departmental application, what is that department? What is it trying to achieve? That's the analysis part. And you need to know that before you can design a system or select a system. Okay, so analysis is always first in the implementation life cycle, and you can't skip steps. So understand that you have to always start with analysis as the most important step, because you can't skip steps and be successful. Okay. All right, I think that may have been the end. Did we have any specific questions about any of those that we went through? Okay, if no questions, I'm going to turn it over to Stan for our next section.
Actually, you're gonna turn it over to me, because I'm gonna say I'm gonna introduce Stan.
Oh, okay.
So Stan Salinas is one of my colleagues up at Chico. He's associate professor of health admin in the undergrad program, and is now developing the health portion of a new MBA program. And he took over this year as the program director up at Chico, and has been working on this stuff for many, many years. So I will turn it now over to him.
All right, good to be here. So let's get going. Next slide. Okay, so 9 knowledge areas of quality and performance management, as I understand it anyway. So knowledge of benchmarking principles and sources of best practice information. I think I would focus more on national standards with this stuff than state or internal, simply because it's a national exam, right? So always thinking from that perspective is probably important. An understanding of the principles and methods of medical staff peer review. So just sort of broadly how it works, how it's typically set up, and what the best practices are for it. Risk management principles and programs spanning everything from safety, injury management, patient complaints, patient and staff security, managerial performance and process improvement tools and techniques. For these, so these can really be divided into 2, I guess, important areas. There's the tools, and that's the plan, do, study, act, control charts, things like that that are used in process improvement. And then the sort of overarching theories isn't the right word that I'm looking for, but your Lean Six Sigma, total quality management, or I should say Lean and Six Sigma separately, because they are 2 separate things, and total quality management. I think it's just, for the purposes of the exam, I think it's just important to understand the sort of overarching theories of each. So Six Sigma, the overarching principle is just to reduce defects. And if you reduce defects, then you can gain a strategic advantage because you're putting out a better product or service, and so on. So I think understanding the fundamental principles of Lean, of Six Sigma, of total quality management, and then maybe just the 2, 3, 4 most widely used tools under each of those is a good way to approach it. You need an understanding of utilization review and case management, which admittedly I don't know a ton about. So next slide. Clinical performance and process improvement tools and techniques. So I touched on that a little bit in 2 bullets ago, I guess, but understanding evidence-based medicine, how sort of clinical pathways work to promote the use of evidence-based management, population health paper for performance. Pay for performance, I think understanding the federal value-based purchasing program is probably the most important piece in that, which actually touches on the HCAHPS, patient satisfaction stuff in the next bullet, but understanding the key principles of value-based purchasing from the CMS perspective, and then understanding, or at least knowing how the benchmarks are set and how the thresholds are set is critical to understanding how that program works. Tools for improving patient safety, that's kind of one of those things that I don't know if there's a way to sort of give you advice other than just knowing what they are. I mean, that's kind of one of those kind of like charts and graphs, right? You either know what they are and know what they do, or not. It's hard to sort of reason through them. And then an understanding of quality as a strategic initiative, separate from operations, and sort of how it fits into the overall strategy of a organization. So we will go through some questions here, and I will do the same thing as Angela did. You guys can answer them, and then I will kind of walk through the logic of each as I see them anyway. So go ahead and, okay. So clinical pathways are important because they provide support in medical malpractice suit, delineate best practice protocols, increase patient throughput, or reduce resource use. So go ahead and put your answers in the chat, and then we'll talk about it. Okay, so we've got some B's, we've got a C coming up. Okay, so the use of clinical pathways, I don't know, may or may not provide support in a malpractice suit. I guess logically that makes a little bit of sense. I would defer to the attorneys in the room. Delineate best practice protocols, they definitely do that. They could increase patient throughput, I suppose, if there was a certain standardization that people were able to achieve through their use. And resource use, I think, is irrelevant with clinical pathways, to my understanding. So A and C, while they're plausible, B is certainly the best answer as I see it. So if you could put up the answer, that would be super. Okay, yeah. Clinical pathways simply help help clinicians have sort of guide rails and operate within best practices and evidence-based protocols. Perfect. And I think, yeah, thank you, Rick. That's a good point in the chat. They only help in malpractice if you followed them. Yes. Okay, so let's go to the next one. Which characteristics of a high-risk process would tend to increase the process, or the risk of a process failure? Simplicity, consistency, variability, or automation. Sorry, gosh. Okay, anyone else want to chime in? Yeah, and so this one, I agree with everybody in the chat. That's good, but you know, answers by consensus don't necessarily mean a whole lot, I guess. But anyway, so the key word is which would increase risk of a process failure. Increase is the point there. And simplicity would reduce the risk. Consistency would also reduce the risk. And automation, if done correctly, would reduce the risk. So by process of elimination, we're left with C. So go ahead and show us the answer. Perfect. Yeah, that one was easy because the others just simply weren't even plausible if we were paying attention to the word increase risk. Okay, next question. A healthcare institution would like to use nationally accepted clinical benchmarks to, and I'm not going to read every one, no reason to do that. So I'll let you guys read the options there and we'll talk about them. Okay. So let's take a look at A. Determine what services the institution should offer to meet the needs of the area. That has nothing to do with a clinical benchmark, so that one can just be eliminated. Obtain a comprehensive view of the state of the institution's business. Again, totally irrelevant. Evaluate the outcomes of a clinical process. Yeah, because you're comparing it to an accepted benchmark. So that one's definitely a possibility. And oversee the clinical structure of an institution. No, the overall clinical structure doesn't have a whole lot to do with the outcomes of a specific clinical process. So the chat seems to have gotten this one right. So let's put up the answer. C, yes. Okay, let's move on to number 4. In designing a risk management program for your organization, what approach would have the most impact on reducing risk? Okay, yeah, so we're kind of, the answers in the chat are all over the place here on this one. And I have to admit, looking at this, I was kind of all over the place with it too. So, so let's kind of walk through it here. What approach would have the most impact on reducing risk? Okay, yeah, and that good point, David, designing. Okay, so developing a reporting system for medical errors and injuries to staff and visitors. I can kind of see where that's plausible. require assessments of high-risk areas or processes within each service department and unit. That one makes a lot of sense because it requires ongoing sort of analysis of what's going on, and those anything that sort of I guess embedded in the processes in reducing risk management is usually pretty effective. Use a task force to address key Joint Commission standards that apply to risk management. I don't know, it's plausible, but it doesn't seem incredibly process oriented, and this reducing risk typically is. Educate staff on potential risks and safety practices. So that one, yes, that one seems incredibly plausible. So let's put up the answer. Yeah, B. So I guess it's the fundamental assessments in those areas or processes, I guess, is where this is going. And D seems incredibly plausible to me here as well. So I could have certainly chosen D, but that is a good point, Michael. Yes, processes are easier to change than people. Yeah, culture eats. Yeah. So anyway, that's a tough one. Let's move on to number 5. In conducting risk assessment, what would be the first action to take? The first action. Okay, yeah, so we have lots of A's coming in to the chat, and the answer is indeed A. And so identifying what could fail in the process, that would certainly be a step in a later step. Identifying causes of failure, absolutely. Would be a later step in the process. And then identifying priorities for action would be way later in the process. Before you do any of that, you would need to identify the steps in the process of concern. So go ahead and put up the answer there. Okay, yeah, and so keyword there is first. Let's go to the next one. Oh yes, the 200-word question here. Medical staff on the general medicine unit has been complaining about the delays in the administration of medications. You study processing times on other units, and you indeed find out that the general medical unit times are considerably longer. What's the first step you take? Okay, let's look at it. We have lots of answers in the chat. So again, this is the key to this one is what's the first step to take. So implementing best practices from other units, that might be done. That might be the sort of, what you end up doing. But you would be skipping a lot of steps if you did that first. Having the manager from the highest performing unit assist, that might be something you would do later down the line. Establish benchmarks for processing times across the organization might be useful, but it's definitely not the first step either. The first step is always form a committee, right? Organize a process improvement team. It seems like that would be the logical place to start. Although I think we all have a bias for action, right? So we just we know they do it better, so let's just implement it. You might find out that there are specific reasons that their process may not work in a different area, or may not work as well, may not be the optimal thing to do. So go ahead and put up the answer. Yeah, so yeah, always form a committee, always get the team together first, and it'll improve buy-in for anything that is implemented in the future. Any changes that are made will be probably better received if there is a process improvement team in the unit to be improved. Okay, let's go to the next one. What tool is most appropriate in identifying priorities for action? Okay, so let's just walk through what each of these do. A flow chart basically lays out the steps of any process, right? And you can add times to them and things like that, so you can see where the process is delayed or where bottlenecks are in a process. So we can keep that one around just in case we don't find something better, but it's not a great answer to this. Cause and effect diagram. This is also known as the fishbone diagram or the Ishikawa diagram. This is a chart that is used when an outcome is known to sort of back into it why it happened, hence the cause and effect. So you start with the outcome and work your way backwards to it, and it can be used as a brainstorming tool as well. The Pareto chart is the one we're looking for here. So Pareto chart, essentially bar chart with that helps separate the vital few from the useful many. So you have a lot of problems, let's say in an organization, a lot of quality problems, but you don't know exactly where they're coming from, or let's say what area, what unit they're coming from. Let's patient falls, for example. And so a Pareto chart will tell you where most of your problems are, so you direct resources to those units rather than to the other units. Obviously, all of the units are important, but you want to be able to prioritize resources to where most problems are. I would look up Pareto principle or 80-20 rule for more information about Pareto and the principles and the chart. And then a run chart is a you know, a chart that shows something over time. So anyway, the answer there is definitely C. So if we could put that up and move to the next question, number 8. What approach best ensures loyalty or return visits by patients to your organization? Surveys, engagement, complaint resolution, or customer service? So returned visits, loyalty. Okay, lots of B's. B is the answer. So patient satisfaction surveys are fine, but you know, most of the data says that patients sort of feel like that just goes off into the ether and nothing really happens to them. Effective complaint resolution process, sure. Service recovery is very important, but it's also after something bad has happened. Customer service training, yes, it's an important factor for loyalty, but patient engagement is an overall strategy for sort of good times and bad with patients, and that the research says that's what keeps them coming back. So go ahead and put up the answer, and we will move to the final question, actually. What action should you take to ensure all critical activities associated with care of a patient are being carried out in the right sequence in your organization? Okay, yeah, let's look at this one. We've got a whole array of answers here. So institute clinical practice. Okay, so first of all, let's take note in the question that we're talking about activities associated with patient care specifically. So now let's look at the options here. Clinical practice guidelines, as I understand them, are sort of broad guidelines for practitioners to follow, but they're not specific pathways. Clinical pathways, on the other hand, are plans of care, evidence-based plans of care. So they're more specific than broad practice guidelines. And then C is instituted disease management program. We can just, I don't know, throw that one out just because it just simply doesn't make sense, doesn't belong. And then D, an evidence-based management program is, well, it's a management program. It's not patient care. So we can eliminate that one. So we really have A and B left here if we've eliminated C and D. And all critical activities associated with the care of a patient. So we're talking about at the bedside here. And clinical pathways are just far more specific than practice guidelines. So we'll go with B on this one. Okay, I hope that made sense or was useful going through it. That's the last question. I would say another thing that can come up in this area too are anything about, not anything, but the overall contributions from people like Edwards Deming, Walter Shewart, Ishikawa, just knowing broadly what those guys did. So that's Deming, Shewart, Ishikawa, important people just to know generally what they did, what their contribution was. Oh, Donna Bedian as well. That's Donna Bedian created the structure process outcome method that we use to measure everything. So
Thank you. Thank you, Stan and Angela. So I think one more comment on the risk assessment is it's also it's a correct answer because it's a CMS condition of participation that you have to do a risk assessments in your high risk areas in the hospital. So you have to identify your high risk areas such as in ER, NICU, or in life safety. So let's probably we have time for our supplemental question. Right?
If we do run out of time, this presentation we'll be sending out later has some closing comments, stuff we've talked about all the way through the session. So, you know, take some time just to take a look at that, just, you know, to get your mindset. But yes, I think the supplemental questions are more important than going over the detail of the closing comments.
Okay, we're ready for the slide. Thank you, Twee. This is for IT.
Do I come back in?
Yeah, sure.
You? Okay. All right. So another question. An application that assesses structured databases of clinical information to aid a clinician provider in defining probable diagnoses or selecting appropriate diagnostic tests or treatment options is called what? All right, let's show the answer. I think you all are correct. Yep. So yeah, clearly it's a clinical decision support. So it does help them make decisions on what may be going on with that patient, the diagnosis and the test or treatment. So good job there. All right, next question. Okay, another regulation question. Programs established by the Centers for Medicare and Medicaid Services in 2011 to encourage eligible professionals, eligible hospitals, and critical access hospitals to adapt, implement, upgrade, and demonstrate meaningful use of a certified electronic health record technology. Okay, let's go ahead and show the answer. So yes, so this is the correct answer. I have to say this one threw me off a little bit because I'm so attuned to, you know, high tech, ARA, Affordable Care Act, all of that, but they did include electronic health record incentive program that was a follow-on to all of those acts. So add that to your list as one of the study guides as well, or one of those areas to study. Okay, a system designed to support decision-making process of an individual or organization through the use of data retrieval, modeling, and reporting. This kind of, the question gives the answer away a little bit.
It's a giveaway, huh, Angela?
Yeah. So that's good. Everybody's getting it right. Okay, go ahead and show the answer. Yes, so it said, what system is to support decision making? So it's a decision support system. So, okay. And then outdated computer software that lacks the features found in more current versions. And this is an important question because this is what's causing a lot of the hackers to get in.
Mhm.
All right, let's go ahead and show that question. Yes, legacy system, and hospitals are full of them. So it's really important to try to get up to date as much as possible. And we know it's expensive. All right, a standard for data formatting that helps to facilitate the exchange of data among disparate systems within and across software vendors. Okay, I think everybody's getting that one right. And even if you didn't know this answer, go ahead and show the answer. Just by reading the question, you can have a process of elimination. So it's a standard for data formatting. It's not an application. It's not an EHR, because we know that's not just a standard. And it's not a PACS system. We know that's not a standard, right? So process of elimination is HL7. And somebody had put on the chat the date, and I think that's a good point. So when you're studying your different regulations, ARA and high tech were 2009, Affordable Care Act was 2010. The one that we saw, which is also called Promoting Interoperability, was 2011. So if you just have those dates, that would have been a good process of elimination on that one question, prior question. Okay, over to you, Stan.
All right. Systematically developed statements that can help practitioners and patients make decisions about healthcare to be provided in specific clinical circumstances are.
I think this is also a giveaway, right, Stan?
Yes, I think so. Anyone else want to take a stab at it? Okay, so go ahead and show the answer. The key here is statements. Guidelines are typically broad statements, and where pathways are much more specific. So let's go to the next one. The application of statistical methods to identify and control performance. All right, let's go ahead and put your answers in the chat. Okay, and go ahead and show the answer. The outcome measure or process measures is, I don't know, they just don't even make sense there. The Donabedian model is the model of measuring structure, process, and outcome to assess quality. And then statistical process control, it's right in the question, right? Statistical control performance. So yeah. Okay, next question. A special type of bar graph that displays the most frequent problem as the first bar, the next frequent bar, and so on is called. Okay, go ahead and show the answer. I don't think we need much explanation with this one because we've gone through it. So separating the vital few from the useful many is the job of a Pareto chart. Okay, next one.
And Pareto chart is also called as the 80-20 rule, right?
Yeah.
80%, 20% rule.
Yes.
Yeah.
A graphic representation between or of the relationship between outcomes and the factors that influence them is sometimes called, and sometimes called cause and effect is. Okay, go ahead and show the answer. Yeah, and this is kind of a, you either know it or you don't. Fishbone diagram, cause and effect diagram, Ishikawa diagram, all the same thing. Next one. A disciplined methodology for process improvement that deploys a wide set of tools following rigorous data analysis to identify sources of variation. Okay. So go ahead and put up the answer, Six Sigma. Yeah, just of all the methodologies, Six Sigma is the most data heavy by a long shot. Lean analysis, not really sure what that is. Lean Six Sigma is, well, it's something that we actually talk about a lot, but Lean and Six Sigma are two very distinct methodologies, although some of their principles work well together, which is why we use them together, but they are distinct methodologies. Types of waste, Muda is from Lean methodology, so that doesn't go. And yeah, Six Sigma is extremely data rich. The whole point is to reduce variation and therefore reduce defects, and therefore give your organization a competitive advantage. Do we have more, or is that it? Oh, you're welcome.
Thank you, Stan. So I think, thank you for your help. And I think we have 3 minutes remaining. Do you have any additional quick reminder, Nora, for the participants?
We've tried really hard during this session. Again, we're not trying to give you all the information you need. We're trying to help you focus on what you need to know within these knowledge areas. Again, most of this information, ACHE has the resources available through their learning resources. Again, the key to the exam is to how to read the question, how to break it down. And again, in our closing comments, we'll have some more of the test taking tips. We're also going to be asking all of you not only fill out the survey, but as you move forward, as you take your exams, what worked, didn't work for you, we're going to have you back as participants. And we're going to be asking you to be faculty. This is how you're going to pay it forward.
Yeah, please don't forget, well, if you receive the Survey Monkey, to please, I'd like to emphasize, take your time, even just take your time to answer that and send it to us, because we strive to improve every time that we have this session and help others to get their fellow. So we would like to get your opinion and feedback to to do more, to do better, right? So I think we will be sending the Survey Monkey in a few weeks, probably 2 weeks. So watch out for that. And as I said, feel free to answer the questions.
So
Oh, wow, Nora, what's that?
this is my tiny coworker. Don't know if any of you had your tiny coworkers coming around during these sessions. So he can now pass the exam too, huh?
Yeah.
Here for all of them. This is Momo.
Yeah.
Hey, good morning. Can I chime in?
Sure, go ahead.
Hi, this is Robin Talvo. So I'm from San Diego, but I just came back from the ACHG Congress. And during the fellow session, it was mentioned that you need to get roughly 65% correct in your exam to pass. I know there was a question on this last, I think on our very first session. So roughly 65% out of the 200 questions or 230 questions that you're going to take. Although the pass rate, according to them, for the initial exam takers is 64%, so it's very low, and they attribute that to people not really taking the exam seriously, because a lot of them are already healthcare executives, doctors, nurses, have accomplished a lot, so they don't take the time to study for the exam. So that's kind of like what the reasoning behind that low number. Over.
Well, thank you. I think Robin has a question, raised her hand, or he's Robin, right?
Yeah, that was me.
That was you. Sorry. Okay, so I think we would like to, thank you for your participation for this 5-week series of our review session. So hope we give you the tips and help you to pass the exam, and we wish you the best and good luck to your fellow journey. So
Just post it, send us your pictures. We'll put you on our Wall of Fame.
yeah, and thank you.
Thank you, everyone.